Atrial fibrillation is one of the most common forms of irregular heartbeats, but with proper management and care, it can be fixed. We learn more in our McLaren Medical Minute.
Hello, my name is Dr. Mustafa Mahmoud Hassan. I'm a cardiologist and a cardiac electrophysiologist at McLaren Flint. I specialize in treating heart rhythm disturbances. One of the commonest arrhythmias that I deal with in everyday practice is atrial fibrillation. Atrial fibrillation is abnormal, disorganized contraction of the top chambers of the heart, or the atria. The atria, instead of contracting in a normal synchronous way, they quiver or fibrillate. That's why it's called atrial fibrillation. Atrial fibrillation is actually the commonest arrhythmia in the world. More than 2 million Americans are affected by this. Atrial fibrillation can result in a variety of symptoms that the patient would feel. The commonest being palpitations, or the feeling of the heart racing, dizziness or lightheadedness, chest pain, shortness of breath, tiredness, and even fatigue. It can also increase the patient's risk of stroke. There are two main strategies for treating atrial fibrillation. The first strategy is what we call rate control, where we control the rate at which the bottom chambers or the ventricles of the heart contract and do not worry about the atrial fibrillation. In this strategy, we have to make sure that the risk of stroke is controlled. The second strategy that we use is called rhythm control. This can be achieved by a variety of methods. First of all, we use medications. This can be aided also by use of cardioversion or a shock. We also use catheter ablation to maintain and control sinus rhythm. In conclusion, atrial fibrillation is a very common disorder. If you develop any symptoms that are suggestive of atrial fibrillation, I highly recommend that you see your primary care physician or a specialist, cardiologist or a cardiac electrophysiologist.
For more information, you'll find a link to McLaren.org on our website, abc12.com.